Namaste, everyone. This is Srinivasa Madinelli. In the last few videos, I've been talking about the health data, the progress that has been made, and the challenges that have been there. And also, talked about the data source, data platforms where I got the data. And there are a lot of really, really good data platforms out there at the global level, World Bank data, IMF, UN, etc. And also there are many good local data platforms as well. So with all that, there's still things to kind of worry or improve. Some of the data challenges are data quality issues. The accuracy. The are the really the data what is entered is accurate or wrong. So we don't know, many times that we don't know, but accuracy is still a big major concern. And many times the kind of quality checks that are there, that deserves to be it really needs to be improved as well. The confidence in many of the sensors and sample services could be anywhere 70 to 80%. It's still not bad. This is my guess. Okay. So, and then the consistency issues are there. Like different states follow different format for various data collection mechanisms. So, with that, it becomes very difficult to compare two different states on various aspects. When we need to compare data, but a lot of national agencies like Niti Aayog, our Ministry of Home and Health and Family Welfare. So that of the central government. So they conduct a lot of census and sample surveys. So they will have some standard format for the entire country. But challenges are that many times the center and states don't agree on the data they provide. They say your data collection is not right, your sample size is not right, your sample picking the sample mechanisms may not be right, etc. But if you use the states provided data, then there'll be quite a bit of challenge because the format themselves can be different. And also many times even the central departments, one department versus other department, they don't have these standard data structures. So then Niti Aayog has tried some improvement in defining the standard structures, National Data Analytics Platform, and they try to kind of harmonize the data from different departments, and they're kind of define the good data structures. But there's a lot to be desired for especially for the data that's already there. And next challenge is the recency. Many times the data is quite old. For example, we are using 2011 data, the 11 census data for all our planning. That's our 14 years old data. All right. So our economy, population has grown significantly, and so many things have changed, and we're still using about 14 years old. That really doesn't make sense. And HMI, Health Management Information System, that's central government health portal. So their data is typically about 2 to 3 year old. I mean, it's okay for historical analysis purpose, but for sort of current and planning, it makes less sense to use such old data. And completeness, so it is another challenge. Many times, we either miss a lot of attributes or what is it that indicators, or so you might miss some geographies, etc. And the granularity is also a challenge. So by various granularity, geography, gender, socio-economic class, age, education, etc. Right. So that data collected for whatever the indicators, unless we have these things, it becomes very difficult to slice and dice this data and look from multiple perspectives. Again, siloed data, as I said, earlier, that there are many departments, either within the same state or within central government, they collect data in a very inconsistent format, inconsistent technique and tools and methodologies. It becomes very difficult to kind of, corroborate this data. Or rather, make that this data sets interoperable. Um, Obviously, data privacy is a concern. It has to be kept in mind, especially with health data and finance data, etc. Right? So, but a lot of and they can be anonymized and shared for the public good. right? So that it becomes easy to kind of plan, where make various policies and plan various programs, etc. So, just to give some examples of the data accuracy, data quality issues, many countries and provinces, states lack infrastructure, resource skills, attitudes, and commitment to collect the data accurately. Right? Often, authorities and regimes hide the accuracy and mislead for political reasons, or fear of public, repercussions. Right? So here is an example of how COVID-19 death data has been kind of guessed to be severely misrepresented, or misquoted. This is a study done by Nature, Nature.com. This is the world's one of the reputed institution, and it says that at least 25 countries with the highest total estimated excess deaths between January 20th. This just between January 20th and December. This is roughly about 2 years data, right? So the estimated death there, for India is anywhere from about 500,000, and what this Nature is saying is it's about 4 million plus, roughly about factor of 8 or 9. The range is quite significant. This is just in between these two dates. If you include 2022 data, it can go further. Okay, so India is not the only country that has kind of seemed to be misrepresented. Definitely, it is India is misrepresented. If you can do the excess death analysis of the different states in this one, you will know about it. In fact, I have data for that for Karnataka. Okay, so India is among the countries that underreport COVID-19 deaths most. China is completely, covered it up. So it is the most populous. It was the most populous country, and this is where the COVID-19, kind of erupted, and they reported very very few deaths. It's unbelievable. So they completely covered it up. And there are many other countries which have done. I mean, maybe it's kind of way to manage the public anger, anxiety at that moment, but at some point, the real data has to come out. Okay. I have done a little bit of analysis on the Karnataka. So Karnataka reported about roughly about 40,000 deaths. But there seem to be excess deaths of 200,000 between 2020 and 2023 period. They have used the eGenma data. I'll show that in the subsequent slides. So if you see this in a factor of excess deaths, so the factor of excess deaths in COVID-19, between what government has reported and what the other systems are telling, it could be anywhere from 4 to 5. And if you extrapolate that, I take that as a measure, the extrapolation, underreporting by the country as a whole. So our COVID deaths could be at least 4 to 5 times higher. So what I've done is here is to show that the excess deaths data. No, there's one thing I just wanted to show you here is the consistency issue, right? These are the data that is reported by the Karnataka statistics department, and he said this is the portal. And if you see here, different year reports are showing data in different formats. In 2015, this was the format, and 2017, this is the kind of summary they're providing. And you see that the report format continues to change. With that, it becomes difficult to compare various things. I think things have started standardizing. I mean, become more or less stable after 2017. So what I'm trying to show here is that so you see that typical deaths on an annual basis is about 4,80,000, 81,000 in a year in the state of Karnataka. And so you can see that between in 2017 it's 4,81,000, in 2018 it's 4,83,000, and if you go to 2019 it was 5 lakhs, and 2020 it jumped to 5,51,000. Significant. Earlier it was increasing by 5 to 10,000 every year, and now in 2020 it jumped by 40,000, more than 40,000 just in 2020 alone. And in 2021 you can see that Typically, it should have been around 5,10,000 or so into 2020. And then if you see here is 1,40,000 excess deaths in 2021. And if you go to 2022, it came down from 6 lakh 64,000 to 5 lakh 50,000. As you know, maximum deaths happened during COVID in 2020 and 2021. 22 it came down, and then 23 it came down further. Okay, still, these are excess deaths, and if you put all of them together, there seem to be more than 2 lakh excess deaths between 2020 and 2023. Right, whereas the actual reported numbers reported by government of Karnataka is 40,000 odd. And Karnataka is one of the better, reported state in terms of the more truthful in terms of number of deaths, that occurred. So, the UP and all have roughly about three times the population of Karnataka, and their deaths have been kind of half the what happened in Karnataka. So that seems to be quite untrue. Okay, there are many states which have underreported: Telangana, Andhra Pradesh, West Bengal, so Bihar and UP. They all seem to be a significantly underreported. Some of the better reported states are, Maharashtra, Kerala, and Karnataka. So these are more the better states. Even Tamil Nadu is to some extent okay, but still they are seem to be underreported. This is another example I just want to show here. It shows this an eGenma annual report. You can go and download this report from here, this portal, and it's a good the thing that they publish this data for the public consumption, and they provide public access, right? You see, one of the key thing they report is that number of registered maternal deaths, right? So in 2020, if I go back here, in 19 it was maternal death was 2001, in 2020 it was 253, and in 2021 it jumped to 336. Okay, so, it could be, we can say that because of the COVID challenges, a lot of maternal deaths happen because there are challenges in terms of providing healthcare things, facilities, right? But if you see the number of deaths that are reported in 2023, it is 35. That seems to be quite low. It can't be so low, and with that, with nearly 1 million deliveries or births and only 35 maternal deaths, our maternal mortality rate is better than United States. Is that a possibility? I mean, I hope that would be true. Kerala probably comes closer to that, but Karnataka, I don't think it is, that close as well. So there seem to be some issue with this data. I'm just trying to highlight the kind of some of the data accuracy challenges that come up with lot of this data collection, collation, and publishing. Right. This is the example. I'm not trying to point finger at any political party or government or state, etc. This is the challenge that will be there. But even if you, I mean, we can ignore some of these things. My overall confidence in the public data is anywhere from 70 to 80%. That's better than not having anything, right? So 70-80% accuracy is really good in my opinion for such a large population. So in conclusion, government data, the challenges they're there, and so especially we have not done the and decennial census that would happen since British era 1880 onwards. The census would be done every 10 years, and this is the first time that which should have happened in 2021. It was not done because of there was COVID going on, but COVID is a kind of was ended in 2023 at the max, right? So we have lost 2 years, and still there is no initiative to start the census. So why is it? And the challenge is that we are using 2021 data, 2011 data for all our planning and kind of analysis and evaluation of various things, right? So that is a really very bad actually. So our population would have gone up by 20 to 25% population. Economy size has more than doubled. So with this kind of old data, so all our planning will be less meaningful, right? And another challenge is the sample service. Obviously, so in olden days, so we could not do take a huge number of samples because of the logistics challenges. Now with the technological advancements and the financial resources we have, really need to take more samples, and we so that the sample surveys are much better representational, and with the kind of limited samples, and so the data it will lead to extreme extrapolation. For example, you take one sample, a village, and decide, okay, the percentage of poverty based on that one sample or two samples. So it really becomes a lot of data. The conclusion becomes questionable. You can use that as more of a kind of directional, but less as an accurate picture of the whole thing. So end of the day, so unless we have credible data, the plan implementations, plans, executions, and evaluations won't be effective or truthful. We as citizens and activists have to really push governments to improve the data collection mechanism. Until that is the case, so all our planning, planning, execution, evaluation will be more like shooting in the darkness or shooting in the little limited visibility, right? So better the data, better the planning, execution, and correction and evaluation, right? And the outcomes will be. And it is critical for governments to improve data collection, curation and sharing mechanisms, and also in institutions, right? So so with that, I think I'll conclude my talk on health data. And these are some of the challenges. This is my first attempt. Please bear with my kind of little bit of dragging in the video. In subsequent videos, so I'll try to be much more crisp. Maybe by that time I'll find some editing tools and techniques. At this time, I don't have. I'm kind of one man army. Apologies for if I dragged in some places. And also, I put a lot of things in very short period, right? Each of the subtopics can be really 10 to 15 minutes story. That's what I'm going to do. For example, the achievements that have been done in some of the controlling some of the infectious disease like smallpox. It's unbelievable story. Very few people know. We really need to tell those stories, right? At the same time, the challenges are also significant. We have to make I will make a kind of focused 10 to 15 minutes video for those things. With that, thank you for listening. Have a good day.